Hi, I'm Dr. Willy Dayan, and I look forward to seeing you all at the NESO meeting in September 2019. We're going to be speaking about leveling the occlusal plane with aligners. We're all familiar with the benefits of pre-restorative orthodontics so that we don't have to prep the teeth in a patient who needs some anterior orthodontics, but it's also about leveling the gum tissue so that we don't have to prepare the gum tissue to create results where the patient has a nice level gum line and a good smile line. So it's more conservative both on the teeth and the gum tissue. But sometimes patients don't need any restorative work to benefit from this kind of orthodontics. Here the goal is to increase smile exposure. The first set of aligners that I received or I would have received would have done a nice job of aligning the teeth, but it wouldn't change her smile line in any significant way. By changing and adapting the aligners to be more useful for the patient under her circumstances to level the curve of spee and then open the vertical dimension and erupt the anterior teeth, we're able to create a smile line that is much more favorable for the patient. And orthodontics is not just about straight teeth. Sometimes we're leveling the posterior occlusal plane. So as in this case, to make room for implants, we want to take the over-erupted posterior teeth, intrude them, and then be able to give room for prosthetic dentistry at the back. In some patients, this is an aesthetic concern. For this patient who has both open bite, cross bite, asymmetries, who's not going to do surgery, not going to do TADS, we're able to close that open bite through posterior intrusion, but this makes a difference to his smile line as well, because when he smiles, he doesn't show that gum tissue in the back of the mouth the way he used to. In patients with canted occlusal planes and facial asymmetries, we can see here that the ClinCheck is very much made to look crooked on purpose in a very customized way so that the patient can enjoy a more level occlusal plane even though he continues to have his facial asymmetries because he didn't do surgery. So once again, orthodontics is much more than just straight teeth. And we can see an improvement in this girl's canted occlusal plane as well from her initial records to her final records. So I hope you'll join me in September 2019 to talk about anterior leveling, posterior intrusion, and how to deal with canted occlusal planes in some difficult cases. Look forward to seeing you. Bye-bye.